Good morning, everyone. Today's lecture will cover a wide range of topics related to diabetic emergencies. As medical professionals, it is crucial for us to be well versed in the management of these emergencies to ensure the best possible outcomes for our patients. Throughout this lecture, we will explore various aspects of diabetic emergencies, from the diagnosis to the treatment options available, as well as the potential complications that may arise. So, without further ado, let's dive right into our first topic. Diabetic ketoacidosis, DKA, is a life-threatening complication of diabetes that requires prompt and appropriate management. It primarily occurs in patients with type 1 diabetes, but can also affect those with type 2 diabetes, especially during stress or illness. DKA is characterized by hyperglycemia, ketosis, and metabolic acidosis, which can lead to severe dehydration and electrolyte imbalances. The cornerstone of DKA management involves fluid resuscitation, electrolyte correction, insulin therapy, and addressing any underlying precipitating factors. Intravenous fluid therapy should be initiated cautiously to avoid cerebral edema, and careful monitoring of blood glucose, potassium, and pH levels is essential during the treatment process. Additionally, close monitoring of vital signs, oxygenation, and mental status is crucial to detect any signs of deterioration. Hyperosmolar hyperglycemic state, HHS, is another serious complication of diabetes, typically occurring in type 2 diabetes patients. It is characterized by severe hyperglycemia, hyperosmolarity, and dehydration. HHS often occurs in older individuals with multiple comorbidities. The primary goals in managing HHS are similar to those of DKA, including fluid resuscitation, electrolyte correction, and addressing the underlying precipitating factors. However, the management of HHS requires more cautious fluid replacement to avoid complications such as cerebral edema. Additionally, insulin therapy should be initiated cautiously, taking into account the patient's insulin resistance and renal function. Hypoglycemia is a common and potentially life-threatening complication of diabetes management, especially in patients receiving insulin or certain oral hypoglycemic agents. It occurs when blood glucose levels fall below the normal range, typically less than 70 mg/dl. The treatment of hypoglycemia involves the administration of rapidly absorbed carbohydrates, such as glucose tablets or gel. If the patient is unconscious or unable to swallow, glucagon can be administered intramuscularly or intranasally. It is crucial to address any underlying causes of hypoglycemia and educate patients on preventing future episodes. Continuous glucose monitoring, CGM, has revolutionized diabetes management by providing real-time glucose readings and trends. In the context of diabetic emergencies, CGM plays a vital role in early detection and prevention of severe hypoglycemia, hyperglycemia, or glucose fluctuations. The use of CGM in diabetic emergencies allows for more accurate monitoring and adjustment of insulin therapy, reducing the risk of complications. However, it is important to note that CGM devices have limitations and should be used alongside traditional blood glucose monitoring methods for optimal management. Diabetic emergencies present a significant challenge for healthcare professionals. However, with a thorough understanding of the various complications and their management, it is possible to provide timely and effective care to our patients. By staying updated on evidence-based guidelines and actively participating in educational activities, we can enhance our knowledge and skills, ultimately improving patient outcomes. While insulin is a crucial medication for managing diabetes, it can rarely induce anaphylactic reactions. These reactions can range from mild skin involvement to severe cardiovascular collapse. Prompt recognition and management of insulin-induced anaphylaxis are essential to prevent life-threatening consequences. In case of suspected insulin-induced anaphylaxis, the administration of intramuscular epinephrine is the first-line treatment. Additionally, supportive measures, such as oxygen therapy, fluid resuscitation, and antihistamines, should be initiated promptly. Patients with confirmed insulin allergy require proper identification and cautious selection of alternative insulin preparations. Adrenal crisis, also known as adrenal insufficiency, is a rare but potentially life-threatening condition that can occur in individuals with diabetes, particularly type 1 diabetes. It arises from an underlying adrenal dysfunction or inadequate exogenous glucocorticoid replacement. The management of adrenal crisis involves immediate administration of intravenous hydrocortisone, fluid resuscitation, and correction of electrolyte imbalances. Timely recognition and treatment are vital to prevent severe hemodynamic instability and potential fatal outcomes. Diabetic nephropathy is a common complication of diabetes, which can progress to end-stage renal disease. Acute complications of diabetic nephropathy include acute kidney injury, hyperkalemia, and volume overload. The management of acute complications of diabetic nephropathy includes optimizing glycemic control, blood pressure management, and appropriate volume resuscitation. Pharmacological interventions, such as diuretics and electrolyte replacements, should be tailored according to the individual patient's needs. Hypoglycemic unawareness refers to a condition in which individuals with diabetes do not experience the typical warning signs and symptoms of hypoglycemia. This condition poses a significant risk for severe hypoglycemic episodes, which can lead to loss of consciousness and potential harm. The management of hypoglycemic unawareness involves meticulous blood glucose monitoring and close collaboration with patients to establish individualized glycemic targets. Education regarding the recognition and prevention of hypoglycemia is crucial in reducing the risk of future episodes. Patients with diabetes are at an increased risk of developing thyroid disorders, such as hypothyroidism and hyperthyroidism. These thyroid disorders can have a profound impact on glycemic control and potentially contribute to the development of diabetic emergencies. Managing diabetic emergencies in patients with concomitant thyroid disorders requires a multidisciplinary approach, involving endocrinologists, diabetes specialists, and thyroid specialists. Close monitoring of thyroid hormone levels, glycemic control, and adjustment of medications is paramount to prevent exacerbation of both conditions. Diabetic gastroparesis is a condition characterized by delayed gastric emptying, leading to symptoms such as nausea, vomiting, and bloating. Acute exacerbations of diabetic gastroparesis require immediate intervention to relieve symptoms and prevent complications. Management of diabetic gastroparesis in acute settings involves dietary modifications, prokinetic agents, antiemetic medications, and, in severe cases, the use of enteral or parenteral nutrition. Early identification of gastroparesis in diabetic patients and proactive management strategies can greatly enhance patient comfort and prevent further deterioration. Pediatric patients with newly diagnosed type 1 diabetes are at risk of developing cerebral edema, a rare but potentially fatal complication. It typically occurs during the treatment of DKA and requires close monitoring and timely intervention. Prompt recognition of cerebral edema involves vigilant monitoring of neurological symptoms, such as headache, altered mental status, and declining Glasgow Coma Scale score. Treatment includes meticulous fluid management, electrolyte correction, and administration of hypertonic saline under established protocols to prevent cerebral herniation and long-term neurological sequelae. In conclusion, the management of diabetic emergencies requires a comprehensive understanding of the underlying pathophysiology, prompt diagnosis, and appropriate intervention. By continuously updating our knowledge, keeping abreast of evidence-based guidelines, and staying vigilant in our clinical practice, we can provide optimal care for our patients and improve their outcomes. Remember, diabetic emergencies demand timely action, effective communication, and a multidisciplinary approach, all of which are essential for providing the best possible care. Thank you for your attention, and I hope you found this lecture informative and valuable.